calls hourly, but after COVID-19, first responders are now receiving more calls than usual for mental illness. WVUA 23's Julia Smith has more on what TPD is doing to make sure they can help everyone the best way they can.
Tamika, TPD spent up to 40 hours this week learning how to answer calls with those who have mental illness. And they said that they learned that they need to answer these calls with more compassion than common sense.
At this point, the United States is in a mental health crisis. A lot of times, unfortunately, police officers and deputies are put on the front lines of that crisis.
And in hopes of helping those in crisis, the Tuscaloosa Police Department had a week-long course learning how to recognize mental illness. TPD has received so many calls regarding mental illness that the phones have been off the hook with people in need of their assistance.
It was not unusual to see 5 or 6 calls on our screen pending for either a mental person call, psychiatric call, or a suicidal person call.
Huntsville Police Department hosted the training, teaching our officers how to know the signs that someone is in crisis, followed by scenario-based training. Officers say that it's important to not only assess the situation on normal emergency calls, but to take it a step further with situations dealing with a mental health crisis.
I think a lot of officers in general do not get people that are in a crisis. They're busy doing other calls, and when they get on the scene, somebody's worked up. They don't know how to handle that situation. It amps them up, and it just makes the situation worse. I think having this training helps you get on a call and be able to calm the situation down than to escalate it.
Now, after this course, officers will do another weekly course learning how to teach their department how to answer calls regarding mental illness. Live in the newsroom, Julia Smith, WVUA 23 News.